The pandemic continues as we close out 2020 with vaccines now being administered. News 2's Brad Franco looks back at the impact of the pandemic right here in the Lowcountry.
March 6th, the first two possible cases of COVID-19 under investigation by the Department of Health and Environmental Control. DHEC would say more cases were likely, but at the time, they said the threat to the general public remained low. That would change about a week later.
Effective immediately, I've ordered the closing of all schools in the state of South Carolina.
On March 15th, Governor Henry McMaster shut down all schools in the state, including colleges and universities.
We know it's going to spread. We need it to be manageable, and that's why we're taking these steps. 2
weeks of virtual school turned into the rest of the school year, with parents and students forced to learn a new way of learning, and Zoom became a way of life. At the end of March, Congressman Joe Cunningham becomes the first Lowcountry lawmaker to announce he has the virus. His symptoms very mild, and he recovered at home. The Bridge Run, Flowertown, Volvo Cup all postponed and eventually canceled for the year, setting up the next big move by the governor.
I'm issuing a mandatory home or work order.
On April 6th, following the city of Charleston and town of Mount Pleasant issuing stay-at-home orders in an effort to flatten the curve, McMaster issues the home or work order statewide and closes all non-essential businesses and limits restaurants to carry out or delivery only. And like most of the country, that had a predictably devastating impact on the economy. In early May, facing pressure from the economy struggling and thousands losing their jobs, the governor lifted the stay-at-home order and also allowed for indoor dining to resume with capacity restrictions. Barbershops and salons also reopened in mid-May.
If that's not a spike, I don't know what is.
With case counts surging after Memorial Day and the reopening of beaches, mask mandates started spreading through the state in July.
These are not numbers that we need to be proud of, so what can we do? The most simple thing is to require masks.
Those mandates impacting the majority of the Lowcountry. July bringing more cancellations. Fireworks displays reduced to backyard shows. As numbers in South Carolina started to show promise, parents held out the hope that the year would start on time and back in the classroom. July also bringing another alarming first. The first confirmed cases of MIS-C in South Carolina, the rare inflammatory condition impacting children and associated with COVID-19.
For the number of people in South Carolina, which is fewer than a lot of states, we have a population similar to New York City. So if you keep that in mind, South Carolina has seen a large number of MIS-C cases, which is very worrisome.
By the end of August, MUSC would be the first in the country authorized to use a treatment for MIS-C called Ryoncil. It's a treatment that shows great promise. Brad Franco, Count on 2.